Unfortunately, due to competing commitments, Ms. Lister isn't able to join us live, but she has prepared these excellent opening remarks, especially for the research forum. So over to you, Ms. Lister.
Hello, and welcome to day 2 of the Asia-Pacific CRVS Research Forum. As a co-chair of the United Nations Legal Identity Agenda Task Force, I would like to congratulate you on hosting the very first forum on this topic in the region. The importance of robust civil registration and vital statistics cannot be emphasized enough to achieve SDG 16.9, legal identity for all. Despite the critical nature of legal identity to improve the lives of people who are the furthest behind, this issue is not receiving the attention or investment it deserves. The development of CRVS systems is often seen as a technical issue of registering people, despite its importance to inclusion and its centrality to better public service delivery. Therefore, I'm very pleased that papers will be presented in this session to address CRVS legislation, digital solutions, and budget advocacy. All of these themes are central to the core business of governments and highlight the importance of CRVS as a foundational pillar for member states to transform the business processes of public services and improve the lives of people. In recent years, the UN has received an increasing number of requests from member states to digitalize their CRVS systems. While digitalization is critical to enhancing the efficiency of public services, too much focus is often given to the technology rather than governance issues. And this digitalization highlights the traditional and new governance challenges that CRVS systems are facing. One of the critical issues we need to focus on is the social contract between government and people. People's personal information, which is collected by registering their vital events, is undoubtedly essential for the government to formulate policies based on evidence. However, when government systems are digitalized and interoperability is enhanced, it will give more power to the government as they are able to collect personal information from different functional registries, leading to increased surveillance capabilities. While necessary surveillance, such as public health surveillance, exists, there should be careful consideration of the governance and human rights implications. The design and implementation of the legal identity ecosystem, whose center is the CRVS, should be built in a manner that ensures human rights are not undermined, through paying special attention to data protection and privacy, data management, and ownership. Another important area is the sustainability of the CRVS system. Even when the system is paper-based, the maintenance of the civil registry often does not receive sufficient funding. When it is digitalized, the government needs to invest in various costs, such as recurrent maintenance costs, retaining adequate ICT capacity, and investing in data security, just to name a few. Therefore, proper budget and human resource management is critical for success. To address the governance challenges of legal identity systems, UNDP is currently developing a model governance framework on digital legal identity. Therefore, I expect that today's papers will be a great resource for our ongoing work, and we see a lot of opportunities for collaboration. Though every country has its different CRVS system based on each culture and history, it is critical to share lessons learned and best practices among member states. Research on country cases based on comprehensive analysis will serve as a great reference for countries to learn from each other's success and challenges. I am particularly impressed that the submitted papers are based on concrete country examples, not only from Asia-Pacific, but also from Africa, and I'm very much looking forward to learning from those different research pieces. Unfortunately, I'm unable to attend this research forum live. However, I am genuinely excited about this session and look forward to learning from those research papers and using some of the lessons learned for the UN Legal Identity Agenda Task Force and UNDP programming. Thank you for listening, and I wish you all a successful forum.
Thank you very much to Ms. Sarah Lister for those very insightful opening remarks. Just highlighting the importance of seeing the strengthening of civil registration systems, not just as technical issues of registering people, but also for upholding and improving inclusion so that everyone can benefit from universal and well-functioning civil registration systems. And I think indeed Sarah's point about the often kind of focused approach on the technical issues when it comes to digitalization is very pertinent for countries seeking to upgrade their CRVS systems. And it also emphasizes the importance of taking into consideration governance and also human rights implications. So thank you very much to Ms. Lister for setting the scene for this first session. So our first speaker is Ms. Vandana Shah. Ms. Shah is the Vice President at the Global Health Advocacy Incubator based in the US, and she will be presenting on locally led budget advocacy as an enabler of CRVS funding sustainability. The paper is authored by Sarah Rossi, Vandana Shah, Lydia Tekla-Mariam, and Om Bera. Over to you, Vandana. Thank you.
Thank you so much. I just wanted to start out by thanking ESCAP and all of the organizers for putting this forum together and for the opportunity to present our work, which is still very much of, in development stage. So we really appreciate feedback, as we're working on this whole budget advocacy framework. So my entire cluster of health system strengthening within the Global Health Advocacy Incubator is very much focused on improving systems, through system reform, but also through increasing domestic resource mobilization. So based on experience that we've gathered across multiple sectors, working with primary healthcare systems, epidemic preparedness, immunization, we have developed, a budget advocacy toolkit, which is relevant for CRVS. And in 2022, we had the opportunity to test this system in a couple of countries, and we've now begun to engage with more countries in Asia, actually, to, further refine this. So this is a great opportunity to share with colleagues from Asia and around the world on the current status of this. Next slide, please. So, this is so we, based on sort of extensive interviews with both global partners, those working on CRVS over the last decade, as well as country partners, we've developed a 4-stage process for budget advocacy. Currently, this entire model is based on partnering, with the government lead agency for CRVS in the country that we're working in. And, the first stage, as you can see, begins with sort of campaign planning, really sort of mapping out, who are the government stakeholders in the CRVS process, which are the budgetary agencies, and also looking at priorities. And I think a lot of this work has already been done by partners, globally, including, UNESCAP, Vital Strategies, CDC, as they've been working with countries looking at business process improvement and mapping. The second phase that we look at in this process is around campaign implementation, where once we've agreed upon priorities for improving the systems, the GHI and other partners engaged in a country would support the lead government agency request for additional resources to actually engage in system reform. And some of this has already happened as partners have engaged with governments to sort of scale up and sustain the CRVS improvements that have been implemented over the last decade. The third and fourth phase, in some ways, based on my extensive experience in budget advocacy on other issues, are some of the hardest. Because with low and middle income countries, sometimes getting resources may be actually easier than governments to actually spend these resources in an accountable and a sustainable manner. So I think this is something that we really have not tested phases 3 and 4, and would really sort of invite input and ideas from partners as we get into this whole process, because we have engaged in a lot of countries, not for CRVS, but in 1 and 2, but 3 and 4 are where we are beginning to sort of deepen the work to help countries really spend these money, these resources that they have generated in an accountable manner, and then making sure that these budget line items are recurring. Next slide, please. So there's, one of the key sort of basis for this entire system was really coming out of, there's CRVS systems, unfortunately are not a priority. So these have been chronically underfunded and are under-resourced. In fact, as partners have begun to engage with CRVS systems, some of them are maybe 50 years old, have not been reformed, and have, old, outdated IT systems. They lack, manpower. And so there are a lot of resource gaps. So I want to sort of just talk about the ministerial declaration, which came out of the second ministerial conference on CRVS in Asia and the Pacific, which called upon member states to ensure sufficient financial resources for CRVS, including by allocating sufficient spending on the development of IT infrastructure necessary for recording vital events. But unfortunately, the budget gaps go way beyond just IT infrastructure. There's a lot of systems change, a lot of, human resources, and a lot of other systems processes. Fortunately for the countries in which we are now engaging in budget advocacy, partners have been active, over the last like 5-6 years, engaging in sort of business process mapping and improvements. And we have a lot to sort of learn from and build on from these systems. Next slide. So in some ways, our goal was to actually, once we developed the theoretical model, which was, ready by the fall of last year, to really actually test this model in a couple of countries. And the two countries that we've actually begun the process of testing the toolkit, one was in Africa, Uganda, and the second country was the Maldives. Both of these were also undergoing the legal review process. And we were simultaneously, clubbing the whole budget advocacy workshop for completing phases 1 and 2, which is really doing the mapping and begin the process of like laying out a campaign in these countries. Next slide. So in some ways, both of these countries sort of, and I'm going to sort of, because this conference is focused on Asia, I'm going to just talk a little bit more about the example from the Maldives. So what we did was we got all of the stakeholders, and as I described, these were stakeholders from the lead agency, that is DNR, as well as other agencies, because, civil registration obviously involves a whole of government approach. So whether it was the police, the home ministry, health, all of these agencies that have a stake in CRVS gathered, for a day and a half long workshop on sort of mapping out the key needs, the gaps. Some of this work, because this was not a focus country, but there was some really great work actually done by the UN ESCAP team on mapping and systems improvement, was also very helpful in for the partners to lay out priorities. We also had some planning folks from the budget, and the finance ministry who were also engaged in the process. And the whole idea was to really look at systems gaps as well as look at areas where resources were required to sort of scale up both IT as well as manpower. Next slide. So in some ways, the budget advocacy process in sort of Maldives, obviously, which is a small country, really looked at, some of the bottlenecks. And I think the two sort of core bottlenecks identified were related to IT and also related to some human resource, which related to, Maldives, like a lot of countries everybody's working in, is also going through a process of creating a national ID system. And they wanted to connect the CRVS system both geographically amongst the islands, but also connected to, amongst various systems and to the national ID system. So basically, we supported DNR's budget advocacy process, by, seeking resources for the development of these IT modules, to integrate the system, as well as to support their need for additional coders, both on a short-term and a long-term basis. And then the government of Maldives actually identified, pilot islands to demonstrate the use of the integrated system, and also sort of draft a scaling up budget for like future years. Next slide. So I think, I want to say one of the lessons learned, like I think this was a much smaller country, but as we have worked, and we're scoping out budget advocacy projects in other countries where there's been sort of an intensive investment from partners such as Vital Strategies and CDC, there's a lot of work already done which could add into sort of phase one of our budget advocacy process, where there has been, intensive sort of review of system processes that need improvement. There have been pilots in place which need to be scaled up. So we're actually now trying to strengthen our budget advocacy toolkit by actually integrating, existing tools that partners have developed on sustainability, on costing for each of these changes, to make sure that the budget advocacy process that GHAI supports is holistic and built on all of the work done over the last decade by various partners. Overall, I would say that just in the sort of pilot phase engagement, clearly there is a big need for budget advocacy, but it needs to be integrated sort of throughout the process, because countries, as they're getting assistance from global partners like the ones present at this meeting, I think it should be made clear that a lot of these changes and sort of support that global partners are providing, because increasingly, we're seeing a lot of resources from World Bank, from regional banks. And I think all of these resources need to be then transferred to domestic resources. And I think that's something that we need to, alert countries and to be engaged in from the beginning, because all of the resources invested by global partners will go to waste if the engagement of the finance ministry to actually adopt and scale up these resources with local country monies, whether it's HR position or IT upgrades, it's very important. So I think I just want to end here, and I would love, input and comments, because this is definitely, work in progress and builds on the work of all of the experts and country partners present in this conference. So thank you, and I would love any comments or questions.
Thank you very much, Vandana, for that excellent presentation on an area of work which I think is definitely gaining more traction as countries seek to strengthen their CRVS systems. And I think indeed that one of the biggest challenges faced is often how to procure investments for these upgrades, but moreover, how to ensure that these investments are sustainable and can also be maintained in the long term. I also had the pleasure of attending the budget advocacy and legal review workshop in Maldives, so I can definitely confirm the great level of engagement of CRVS stakeholders, and there was clearly lots of excitement in the room around budget advocacy. So we're really looking forward to see what's coming next in Maldives. I'd like to open up the floor for questions. I see that we have one question from Dr. Mutalin. Do you plan to implement this toolkit for CRVS strengthening in some country in the near future as a regular project?
Yes, absolutely. So in fact, already, we have, from being in pilot phase, we are now fully sort of, as we said, fleshing it out to all the phases of the budget advocacy in Maldives. And in Uganda, we are now already working in Vietnam to actually support budget advocacy based with our local partners, Vital Strategies, to get ICD-10 coders placed within the Ministry of Health. So absolutely, I think, any country suggestions that you think that could benefit from budget advocacy, we would be very happy to engage. We probably have internal resources for, and plans to engage in up to 6 countries in the coming year.
Thanks, Vandana, and that's great to hear that you've already started working in Vietnam. We have a couple of minutes left, so we'll see if anybody else posts a question in the chat. But in the meanwhile, I wonder if I could also ask a question. I was wondering that in the Maldives budget advocacy strategy, I wonder if you could speak a little bit more about what kind of tools are being used to demonstrate to the decision makers the value of investing in the system.
So I think one of the, I think this is a very challenging time to do budget advocacy because, governments are very cash strapped. So I think in some ways, we're finding this on a lot of other issues on which I do budget advocacy. And so I think in the Maldives, they clearly out of the process, prioritize, system integration, both geographically as well as system wide, across systems, as well as HR needs, so there was IT needs and HR needs. And I think, Maldives being a tourism-based country, they had a real fiscal crisis. So I think what worked in our engagement with the lead ministry as well as with the government was that GHAI could provide some very short-term resources which would provide a proof of concept literally 3 months, and that would result in adoption and scaling up of these resources by the government, because in some ways, even though they recognized the need, they weren't willing to do a immediate investment. So I think, that's, sometimes, in sort of a cash-strapped environment, or when the lead agency wants to make a case to its government, sometimes showing the proof of concept by a very small sort of investment of funds is sort of the model that we had to use.
Thank you very much for expanding on that. I don't see any more comments in the chat, so I think we'll move on. But thank you very much, Ms. Shah, and to participants wanting to know more about the budget advocacy framework and sustainable financing for CRVS. Please do join the Ask the Author session, which will be happening at the end of this current session. So that leads us nicely onto our next speaker, who is Ms. Lydia Teklemariam, who is also from the Global Health Advocacy Incubator and will be presenting on CRVS legal reviews. And as you just heard from Ms. Vandana, this is something that is also being done in coordination with the budget advocacy work. So over to you, Lydia. Thank you.
Thank you, Chloe, and hello, everyone. In my presentation today, I will be focusing on the other portfolio at GHAI, which is CRVS legal reviews and reforms. And I will particularly focus on the legal review and reform projects that have been started in the Asia-Pacific region. Some of these are pending, some of these have been completed, but most of them have been initiated since 2017. Next slide, please. To just refresh your minds about what the CRVS legal and regulatory review is, it's a carefully guided step-by-step evaluation of a country's CRVS legal frameworks. It is completed by local lawyers with oversight and support from GHAI, and the process identifies whether a country's current legal instruments are in alignment with international best practices for CRVS. So the results will be concrete, actionable recommendations for legal reform, and from the beginning till the end, it's done hand in hand with the relevant country stakeholders for CRVS. Next slide, please. Again, the purpose of a CRVS legal review is to identify the gaps and obstacles in a country's CRVS legal frameworks and policies that prevent the timely, continuous, and universal notification and registration of vital events. So it helps identify where the gaps and obstacles exist and how they can be addressed. So the resulting recommendation report will provide the ways in which the CRVS legal frameworks can be strengthened and can better reflect international best practices. It also helps clarify the roles and responsibilities of various stakeholders involved in the CRVS system of the country, and it builds and solidifies their collaboration. So legal reviews, they not only inform legal and policy reforms, but they also inform public health decisions and CRVS system improvement initiatives. And for this reason, we say conducting a legal review is an essential step that countries should take toward achieving universal, permanent, and continuous civil registration systems that are capable of producing accurate vital statistics for better public health data production and use. Next slide, please. CRVS legal reviews are conducted using what we call the CRVS Legal and Regulatory Review Toolkit. This toolkit was developed by GHAI and Vital Strategies under the Bloomberg Philanthropist Data for Health Initiative. The toolkit provides guidance for local lawyers to analyze the relevant laws of their countries that govern the CRVS systems, and they provide a guidance for comparison of these laws against international best practices for CRVS. So this toolkit helps countries identify the gaps and obstacles in existing CRVS legal frameworks, but they also highlight opportunities for improvement. This toolkit now has 13 chapters on distinct topics and aspects of CRVS, and it's being used to guide CRVS legal review projects. So far, it's been used in about 30 countries to date, and 12 of these countries are located in the Asia-Pacific region. Next slide. So these are the 12 countries in the Asia-Pacific region where we have initiated and in some cases have completed legal review and reforms. 9 out of these 12 countries have been addressed in the chapter, in the paper. And in the next slide, I will be discussing a bit about the findings and recommendations from the legal review and reform projects in the 9 countries in the Asia-Pacific. So these are the 11 common issue areas that we have identified from the 9 countries that have completed CRVS legal reviews in the Asia-Pacific. The first in the list is related to the structure of the civil registration system. So in Bangladesh, Maldives, the Philippines, Papua New Guinea, Solomon Islands, and Vietnam, gaps have been identified in the way that the civil registration system has been structured. And some of the issues that identified as structural challenges include, in some cases, the lack of laws that authorize civil registration functions or that failed to make civil registration services accessible to all members of the society. In some cases, the laws have failed to establish coordination mechanisms, but in some cases, the legal review also helped identify good practices in some of these countries in terms of making services accessible to certain population groups through decentralization, and the recommendations that have been made in these legal review processes include enabling the use of technology to advance civil registration functions and ways for ensuring universality through law amendment and also supplementing existing laws with certain legal instruments. And as you know, when vital events occur in health institutions, the most effective approach would be to designate the health sector as the primary informant for the event. So for the legal review and reform projects in Papua New Guinea, Cambodia, and Bangladesh, recommendations have been incorporated to designate the health sector and increase its role in birth and death registration, as well as the vital statistics production process. Allowing the registration of vital events at both the place of occurrence as well as the place of residence was another measure that's been recommended in the law reform process in Cambodia and Bangladesh in order to make the registration service accessible and available to all population groups. And in Vietnam, Papua New Guinea, Solomon Islands, and the Philippines, the recommendations specifically address the legal and administrative requirements for registration of diseases. Another common area for recommendation was the information that gets collected during vital event registration, and most of this relates to aligning to international standards and best practices in order to ensure that the national registration process enables the collection of relevant data, and existing laws are able to provide detailed procedure for this process. And this has been the case in Sri Lanka, in Bangladesh and the Maldives. Another common issue area for CRVS improvement programs across several countries in the Asia-Pacific was the medical certification of cause of death. The challenges and the recommendations made in each of these projects has been different, and the recommendations include, for instance, in Sri Lanka, it was related to the absence of a legal mandate for cause of death determination, whereas in Bangladesh, it was to introduce changes in the system that required family informants to provide a cause of death information in the absence of a medically certified cause of death. And it was, I could go down the list, but in the interest of time, I would skip that and I would invite everyone to read the paper. But the recommendations as well as the gaps were different in each case for the medical certification of cause of death. And the use of verbal autopsy for diseases that occur without medical care or supervision was also covered in the law, in the legal review process. And also it was part of the law reform efforts in Papua New Guinea, Bangladesh, and the Maldives. And also recommendations were made in Bangladesh, Solomon Islands, and Maldives to address the issues of late and delayed registration in order to advance timeliness and accuracy in the civil registration process. Accessibility of civil registration services was another challenge that was identified in a number of countries, including Vietnam, Solomon Islands, Bangladesh, Cambodia, and Papua New Guinea. And specific recommendations were given in each of these projects to increase coverage and also remove barriers for the population groups that have been identified as impacted by the existing legal and administrative procedures. When it comes to stillbirth reporting and registration, the legal review projects we had in the Asia-Pacific region recommended mainly empowering the health sectors in Cambodia, Bangladesh, and Solomon Islands with the authority to collect data on fetal disease or stillbirth. Other gaps have also been identified in these legal review processes, but one example that's worth mentioning here is the project in Thailand, where the legal review was entirely focused on stillbirth registration and reporting, and the recommendations had been successfully implemented, leading to a policy win and adoption of standard operating procedure in Thailand. Vital statistics was also another common issue area identified in Papua New Guinea, Vietnam, Bangladesh, and the Philippines. And the recommendations were to mainly introduce necessary changes in the process of collecting vital statistics so that uniformity of procedures at all stages of the process could be ensured in order to increase efficiency, accuracy, completeness, and effectiveness in vital statistics production and use. The last common issue area is related to the national identity registration process, and in Bangladesh, Maldives, and Vietnam, different legal and policy recommendations have been made for identity registration. In Vietnam, the recommendation was to authorize the commune level police to participate in the citizen identification card issuance process and to decentralize the authority by one step further. Whereas in the Maldives, the main recommendation was to specify the age of enrollment into the national ID system to provide mechanisms to protect individual data from identity theft, and also prescribe processes for appeal and identity retirement. In Bangladesh, the recommendation was to amend the laws to establish and regulate the digital platform and include efficient and easy and swift process to update, amend, or correct the national ID information. Next slide. So like I said earlier, several countries have completed legal reviews. I would say successfully completed legal reviews So far, about 20 countries have conducted legal reviews, but only 8 countries have successfully conducted a law reform process or adopted law and policy reforms in their legal systems. So even if this is a significant process in a CRVS law reform or law review process, the fact that it's only a few countries in the Asia-Pacific region have stepped up to adopt new CRVS laws or introduce policy reform measures makes us think of a different approach to support the whole process from the beginning to the end in the review and reform process. So we believe legal review is a crucial starting point in the pursuit of CRVS legislative reform, but the reform stage is where the real population level impact lies. So for that, we plan to strengthen our D4H intervention so that we can support countries through the entire process through deeper strategic and long-term engagement at the country level. And some of the countries that we support are currently prioritized for law reform. So in these countries, we plan to continue our engagement with the country stakeholders, government stakeholders, so that we can push for law and policy change. But we also plan to engage civil society organizations for multi-year implementation of advocacy campaigns, political advocacy, media advocacy, and citizen-led advocacy to actually achieve the law reform or the policy reform process. I think that's it. I'm ready to get questions.
Thank you very much, Lydia, for that wonderful presentation. And it's great to see that the legal review work has been conducted in so many countries in Asia and the Pacific. I think this was also highlighted by the keynote speaker for this session, Ms. Lister. The analysis of current legal structures that underpin the civil registration system is such a critical element of CRVS system strengthening. So thank you very much for that great presentation. We have a few minutes for some questions. So please do post your questions or comments into the chat box. Perhaps while we wait to see if there's any questions from the floor, Lydia, I wanted to ask you a question. Maybe it's a bit silly, but I imagine it also depends on the country which you're implementing this work in, but typically how long does it usually take for the legal review process from inception to completion or adoption of a new law?
So like setting aside the adoption process, the review process on its own would take 9 to 11 months from beginning to end. If we're keeping on track and if everything is going as planned, that's how long it would take. But usually what's difficult is to get to the legal reform stage, because usually it would take governments and stakeholders a lot of time to make policy decisions. So it could take years or it could take lesser time depending on the interest of the stakeholders, their readiness for law reform, and their prioritization of the CRVS improvement initiatives that are included in the legal review process. So I would say for the review, usually because there's an oversight from JHI, of course, and also it's done through a contracting process with a local lawyer and in close collaboration with the country government stakeholders, it would not take more than a year in most cases. But what's difficult is to get to the actual reform process, which is impacted by several factors, economic factors, political factors, and a lot of other things.
Thank you. Yeah, I can imagine it must be quite challenging to get through the reform phase. There is one question there's two questions that have come in. One from Peter from Philippine Statistics Authority. And the question is, what do you think are the major challenges that affect the legal framework in CRVS?
One thing that came to my mind is countries not, like reviewing or checking their laws time to time to ensure alignment with international practices, because in some countries the CRVS laws may be very much outdated and very old, and that obviously cannot reflect international best practices as a whole or in part. So maybe countries not prioritizing this activity could be the major challenge, because usually I believe it's a recommendation for countries to at least do a review of their legal frameworks every decade. But if that's not done, there is a very high probability that the laws may not be in line with best practices. So that not being ready for law reform or law review could be one challenge.
Thank you very much. And the next question that came in is, are there some priority countries you focus for the legal reform process?
Yes, definitely. To just give some examples from the list I showed earlier in the Asia-Pacific region, new CRVS laws are due for adoption in Bangladesh, Cambodia, to give just a few examples from the Asia-Pacific region, but we're also working to at least get new laws drafted in other countries in Africa and Latin America as well.
Thank you. We have two more questions. Sorry to bombard you. Christoph says challenges surround not just the law, but the actual implementing regulations to ensure legal changes trickle through to the administrative level, but often this isn't happening. Is capturing these granular regulations also part of the review methodology?
Yes, because in the legal review toolkit, the definition given to CRVS laws is broad to cover all legal instruments that are relevant to the CRVS system of the country. So definitely the legal review in a certain country will cover all laws that are pertinent to the CV registration and vital statistics, and in some cases the identity management systems. So all regulations, or depending on the kind of legal system that the country follows, it could include proclamations, regulations, acts, rules, and also it could go down to administrative procedures, and in some cases it could also go down to actual practices whenever there is like a clear conflict between the law and the practice. So the whole idea is to capture all things that affect the CRVS system in order to make recommendations that could address those challenges. So yes.
That's great. That's very clear. Thank you. Mr. Shafkat Hussain asked, since India is now reviewing its act that was initially formulated in 1969, are there any recommendations that you would like to make, given that you have led the legal review process earlier?
I can jump in here. We actually had submitted comments when there was an open comment process, along with our CDC partners. And there's, several key gaps. I would say one of, some of the gaps really sort of were around the fact that, stillbirths were not recorded. There was also key gaps around lack of, medical cause of death requirements, also around, transgender and gender rights. In fact, based on some of the review at that point, we have now undertaken a subsequent review, both of the national laws as well as state laws, because a lot of the implementation obviously happens at the state level, really focusing on, gender-based issues of, LGBT, women and children, because those were some of the major gaps, as well as sort of the medical cause of death. But we have very comprehensive comments, and we'd be happy to share. Those were submitted to the government.
Thank you very much. And I think that nicely brings us on to just to say that please do, if you have more questions for Lydia, please do join the Ask the Author session at the end of this the presentations today. Thank you very much, Lydia, again, and we look forward to seeing you in the Ask the Author session later on.
Thank you.
Okay. Our next speaker is Mr. Shafqat Hussain, who is a social policy specialist with UNICEF Rajasthan Field Office in India. The title of Mr. Hussain's presentation is A Digital Solution for Strengthening the Civil Registration System in Rajasthan. This paper looks at the digital solution called Pehchan, which was introduced in 2014 and has been instrumental for registering over 20 million births, 5 million deaths, and nearly 2 million marriages in Rajasthan. The paper was co-authored by Dr. Om Prakash, and over to you, Mr. Hussain, to tell us more. Thank you.
Yes, thank you so much. A very good morning to everyone. I hope I'm audible.
You are, thank you.
Okay, great. So thank you for this great opportunity. I also got an opportunity to attend some of the sessions yesterday, so very interesting. I'm here to talk about a solution that has been tried out in Rajasthan by the state government, like you mentioned, way back in 2014. And we're still on that learning curve, so it's still a journey that continues. I'm just going to take you briefly through what was the situation and how the solution is really helping the state to move forward, especially given the fact that this in a way contributes to the larger e-governance framework that the state is looking at. So may I request for the next slide, please? So upfront, I would like to start by acknowledging Dr. Om Prakash Berwa, who is an officer of the Indian Administrative Service and heads the Directorate of Economics and Statistics in Rajasthan. He has been a key pillar of support for this initiative right from the beginning, and even continues to help in strengthening and growing this initiative. So he has been a co-author here. Next slide, please. So in Rajasthan, if you look at civil registration system, then it broadly covers registration of births, deaths, and marriages. The registration of birth and death is governed by the National Act, which is the Registration of Birth and Death Act that was formulated way back in 1969. And based on that, the state had also framed its own rules. That was in 2000. The registration of marriage is covered by the Rajasthan's own state level act, which was passed in the year 2009. We still do not have a national act in India, and different states have come up with their own acts based on a Supreme Court verdict. If we look at Rajasthan today, then of course we are inching quite close to universalizing registration of birth and death. Marriage registration is still a challenge. We do not have very clear estimates, but a study done by UNICEF recently points to about 35% coverage on registration of marriage. But I would like to take you a little back to 2013, where in addition to the low coverage, we had significant issues around duplication, the timeliness of registration, the accuracy of data, and a generic inefficiency in the monitoring system of CRVS. Given the fact that while the CRVS in Rajasthan is governed by the economics and statistics wing, there are contributing roles from various departments. So the hierarchy is not linear. There are various departments that contribute to it. So there is health department, there's women and child, there's Panchayati Raj, which is the local governance, there's urban development, and also the IT. So therefore, monitoring itself in a manual system was a huge task, and so was the coordination among these different entities of the government. Next slide, please. So to tackle this kind of a problem, what the state felt is to really look at a digital solution that can work at scale. And it was also appropriate because that was a time when Rajasthan was also coming up with its own e-governance policy, which eventually got passed in 2015. So it was in 2013 that the state reached out to National Informatics Center, which is an agency created by the Government of India under the Ministry of Electronics and Information Technology. And the primary purpose of this entity is to provide digital or IT solutions to various entities of the government. So that's how the state government reached out to them. There were funding that was available under a World Bank supported project, so that became the source of resources on which the government started its work. There was a small study that was undertaken to better understand the situation that was prevailing in Rajasthan. And a small pilot project was launched. Initially, it was done in one district, then it was taken up to another two districts. And finally, by the end of 2013, the government felt that it's ready and it should be tried out at scale and not continue with the pilot. So that's how Pehchan was launched in January 2014, together with handholding, capacity building, establishment of a toll-free helpline, which continues till date, and also initiation of video conferencing facilities for district and sub-district level functionaries. Next slide, please. So primarily, if you look at Pehchan today, what it offers is a facility for all registrars to register births, deaths, and marriages online. So they can do it using a dedicated dashboard. There is also a Pehchan mobile application. And we also have something called as citizen kiosks. There are about 60,000, and it's called e-Mitra in Rajasthan, where anyone can walk in and get the registration done by providing the necessary documents. We have completely done away with the system of manual certificates. So now everything is digitally signed. So you do not have to run around for getting a certificate after registration. It can be delivered via email or an SMS, or you can just print it wherever you are. Um, One thing that Rajasthan has also done is to link this registration process with India's unique identity system, which is Aadhaar. So what it does is that for any event that needs to be registered, so for example, if it's a birth to be registered, then the Aadhaar of parents is required. That gets authenticated, and then only the birth registration moves. This was very crucial for the state because we were really grappling with duplication of registration of vital events. And this to a great extent has been able to minimize it. Then, of course, because it's an online system, so we get real-time progress updates. There are customized reports that are available. Then on the certificate, there is a provision of QR code, so that makes things pretty easy when it comes to verification. So, for example, if it's a claim in case of a death for an insurance agency, then agency just needs to scan the QR code and verifies the validity of the document furnished to it. The state has also created a Raj e-vault, where all the digitally signed certificates are securely kept so that it's easy to retrieve the information and also do triangulation at times. For citizens throughout the process of registration, there is a facility of receiving alerts via SMS. So people are in the loop, they understand how far the work has progressed. Like I mentioned, the toll-free helpline continues, and also to minimize this kind of a human interface, there is another artificial intelligence-based NIC chat interface, Nikki, which has been launched. So for addressing generic queries, one can simply log into the Pehchan website and get on this chat application. Next, please. So if case of registration, pre-Pehchan and post-Pehchan, so we are not quite there when it comes to 100%, but then the pace has really doubled. So that is one. The second is, if we look at the graph below, which is about the trends in level of birth registration, we'll see how we are witnessing a change in the timeliness of registration, which is within 30 days of the event, of occurring of the event, which is free of cost here in India and does not entail any penalty. So while it has moved from 90% to 96% for delivery for events that have taken place in an institutional facility, for births that have taken place in a non-institutional facility, that's it could be home or any other such location, it has actually moved from 27% to nearly 80%. So that's a huge jump, and that has been the major struggle for state to register non-institutional births. We still have the last mile issue, but then that has been a major change, if we can see post Pehchan. The next slide, please. And the third critical area of result is where actually the state really wanted to walk this path, which is to do with the e-governance policy. So how this small solution is really linked with other IT-based systems in the state. So for instance, we have something called as Jan Aadhaar, which is a single registry system for Rajasthan. So this single registry is getting updated on a real-time basis using data from Rajasthan CRVS, which is Pehchan. So every birth, every death, and every marriage updates this registry. Then there are departments like food and election, which requires updating on a frequent basis of their beneficiary database. So they are taking help from Pehchan and updating their roles. In the health system, we have some Pehchan is actually using this information to update itself. So we are also trying to see what information is getting captured in the health system. And if these events are getting missed somehow in Pehchan, then we identify these events and then there is a proactive work that takes place to make sure that they are included in the Pehchan system. Next, please. Having said that, like I mentioned, that it's a journey. We haven't reached the closure yet. So there are a lot of issues. One, of course, is because when we look at Rajasthan, within India, it's the second largest state in terms of the land area. So with that also comes its own challenges. So we have the largest desert in India, which is the Thar Desert in Rajasthan, which is the western part of the state. Then there's a southern tribal area of Rajasthan, and then there is an eastern ravine area of Rajasthan. These three areas come with their own unique geographic challenges. So even till date, we are grappling with issues like internet connectivity, which causes delay in registration and also at times leads to missed events because how many times would a beneficiary really, approach the government? Then there are also issues around lack of awareness. So we do still have within India a very low level of literacy. While we do have a formalized system of notifiers in place, the efficacy of the system, especially when it comes to last mile, is still something that the state is working with, given that there are so many actors involved. The third area is about quality of data. So while we are in a position where we have reached a milestone of 90% plus coverage, we haven't really been able to make use of the statistical data to the extent that we would like to. So that is an area that requires thinking. A second linked issue here would be like while the health system and the Pehchan system are speaking with each other, but we are still not using each other's data. So there might be, statistical information that is available in a better format in health system, which can actually come in handy for Pehchan, but that has not really happened so far. So that's an area which we are looking at. Next slide, please. So there are two things that I would like to conclude with here. One is, of course, if you look at within India, given the fact that Pehchan has been developed by the NIC, which is an entity within India, so it's easily replicable and scalable. So any state willing to create a system of this nature can actually simply contact NIC and get it done. The second bit is for Rajasthan, it's crucial given the fact that there's a huge push towards use of the single registry system Jan Aadhaar, which has more than 70 beneficiary schemes linked so far, and another 100 to be added. Pehchan becomes one interesting platform which, if provides the correct information to the state system, then benefits can actually be auto transferred. So we tried this with one scheme and we were quite successful to a great extent. Next slide, please. So this, of course, is the final slide. One, of course, where we would like to really explore is the possibility of creating an offline version of Pehchan, which is not offline in a true sense, but offline as in the information can be stored for a limited period of time, and as and when there is internet connectivity, it can be pushed. So right now, in the absence of an online virtual connectivity, at times that there is a struggle that there is a beneficiary who is willing to register, but then the registrar is not able to do so. So by creating a system of this nature, we should be in a position that we don't miss on such events. The second is, of course, strengthening the statistical data generated through Pehchan by way of exploring interoperability. Yesterday, a speaker spoke about it. The third would be that given that we have a vast network of registrars and sub-registrars and notifiers working with at least 5 to 6 line departments, so we are exploring how do we make use of e-modules. UNICEF has tried to work with the national entity to develop e-modules. So Rajasthan is willing to try that out. We still would be requiring resources to be invested in IEC, especially for awareness generation. And the fifth crucial part is while we are syncing with the Aadhaar system, so far Pehchan has not been able to contribute to Aadhaar in a way that the Pehchan database becomes the database for Aadhaar to do proactive enrollment. So we are trying to explore how Pehchan database can actually feed into Aadhaar database, and we can try and start with birth registration. There have been efforts going on in India, but these are where the Aadhaar entity itself is doing it. So we are trying to explore whether this can happen via the Pehchan route. I'll stop here, open to comments and suggestions. Thank you.
Thank you very much, Mr. Hussain. It's fantastic to hear about the significant and positive impact that Pehchan has had on birth and death registration completeness rates in Rajasthan. I was especially interested to see how Pehchan has not only increased birth registration for health facility births, but also for those births occurring outside of health facilities, which I think is a really significant achievement. I'd like to open up the floor for questions now. We have a few in the chat box. The first one came in from Raj Mitra, and that's, is the Aadhaar number given to newly born children? It seems that the link to Aadhaar is to deduplicate the birth registration by verifying parents' Aadhaar number.
So yes, this is correct. So Aadhaar number is not given to a newly born child. That's an area we are still exploring. Right now, the Aadhaar link is primarily to deduplicate. So we take Aadhaar numbers of either of the parents of the child to get the birth registration done in the system.
Okay, thank you. And then from Dr. Musalin, please comment on the level of coordination between the health sector and the civil registration department.
So in Rajasthan, like in other states of India, we have a mechanism of an interdepartmental coordination committee, IDCC we call it. This is largely to coordinate between the civil registration system and the other line departments that contribute to it. So health department is also a part of it. Then the health management system, which I mentioned, which is pregnancy and child tracking system, that is linked with the Pehchan or the civil registration system in Rajasthan, where of course, we are right now the beneficiary of the health system. We are taking information from the health system to update Pehchan. The two-way relationship is still amiss, which I mentioned that probably what we are trying to do now is to look at how Pehchan can also take statistical information from the health system so that kind of duplication is avoided. And also how Pehchan can actually start feeding back to the health system, which is not happening at the moment. There is a basic relationship that exists that needs to be strengthened.
Okay, thank you. Thank you very much. We've got time for maybe 2 more questions. There's a question, is there any plan to digitize the cause of death information on Pehchan?
Yes, so actually that has been included in the Pehchan system. So all the codings for MCCD are now inbuilt in Pehchan. So that is done. But we still have a very low coverage of MCCD in Rajasthan. We are trying to push that.
That's great to know. Thank you. And from Philip Setu, curious how Aadhaar can keep up to date registrars without linking to death registration.
Yes, I think that is a challenge that we have in India. If I can speak about Rajasthan, then for Jan Aadhaar, this problem is taken care of. So the death registration actually, takes that beneficiary out from the Jan Aadhaar registry. But for Aadhaar per se, there is no exit. So once you are enrolled in Aadhaar, the event of death does not really de-enroll you.
Very clear. Thank you for those very comprehensive answers. So I think we'll move on to the next speaker, but thank you very much, Mr. Hussain. And please, I encourage all of those with questions that we didn't get to, but to please join the Ask the Author session at the end of the presentations during this session, and you can ask Mr. Hussain some of your questions. Okay, the next presenter will be Dr. Mohammed Cholifahani. Dr. Cholifahani is Director of Population and Social Protection at the Ministry of National Development Planning in Indonesia. and his presentation is on applying legal analysis and business process mapping for CRVS system strengthening and the lessons learned from 3-district study in Indonesia. And this study is co-authored by Haryadi Sabah, Vidi Larasari, Santi Kusumanengrum, Putri Kusuma Amanda, and Ramadi Usman. Thank you very much, and over to you, Dr. Chulisahani. Thank you.
Thank you, Flo. Good morning, ladies and gentlemen. I'm honored to be here today to present our study on the applying legal analysis and business process mapping for CRPS system strengthening, lesson from 3-district study in Indonesia, commissioned by the National Secretariat of CRPS. So our study also in collaboration with the Center on Child Protection and Well-being at University of Indonesia and supported by Vital Strategies. This study aimed to understand and CRPS system business process and data flows in Indonesia from event notification to certification and also vital statistic production. Next slide, please. Yes, here is we are get together with our colleagues from Puskapa and also me and my friend from Ministry of Planning. Next slide, please. The government of Indonesia has established its national strategy on civil registration and vital statistics, CRPS, through presidential regulation number 62 years 2019. So we have the national secretariat to implement the CRPS issues. And the objective is how to acceleration and accelerate a population administration for the development vital statistic. So the government has also successfully implemented a single identification number. Next slide, please. For nearly all citizens, but the quality and completeness of civil registration data remain significant challenge. If you look here in this data, although the birth registration covered showing up and also upward trend for the children, but the death registration is very low, and the data on the causes of death are either insufficient or unavailable in many parts of the country. On the other hand, various good practices have also emerged from national and regional government and community organization. Next slide, please. So if you look here, ladies and gentlemen, there are good practices that have emerged from the national and regional government and community organization may strengthen the administrative system, but also creating the complex and potential unconnected parallel mechanism. So we need to understand all this, and also therefore government of Indonesia, the Secretariat of the CRPS National Strategy, or we call that Seknas AKPESA, in collaboration with Vital Strategies and also PUSKP, is working to understand the CRPS system business process and data flow in Indonesia from event notification to certification and vital strategies production. So by jointly a legal and regulatory framework and business process mapping approach, so we are by the two approach. So this study aimed to assess the current key business process and sub-process, and including contextualize them with the recommended legal and regulatory best practices, and also identify opportunity to strengthen the Indonesian CRPS system. Next slide, please. Here is, as I said before, so in the legal analysis was conducted using CRPS ID Legal Review Toolkit. So that developed by the Global Health Advocacy Incubator and data for health partners. So the legal analysis cover various aspects, including like the structure of CP register system, and then registration of birth and death, and determining the certifying causes of death, production of vital statistic, marriage, divorce registration, and also national ID system. So each chapter of the legal analysis present best practices on the specific topic and addresses key question guiding by CRVS ID legal review toolkit, ensuring the thorough structural assessment. So we are also the 61 laws and policy document were meticulously assessed by this approach for this legal analysis, comprising like the national level law and then presidential regulation, and also India technical ministerial policies, and also sub-national level policies. In this sense, the study of the legal review focus on the structure of CP registration system, birth and death registration, and then cause of death certification, and also vital statistic. Um, and the second one in the CRVS ID business process mapping, this map for birth and death registration were initially contracting based on information gathering from existing regulation and thorough death review. So also in the second approach is aim to understand business process for cause of death certification and vital statistic production. These aspects were yet to be strongly institutionalized at the national level. Consequently, the study also investigate local opportunities and effort to improve cause of death certification and vital statistic production. So in the total of our approach is 161 participants were involved via district consultation, and also 23 informant at the national level. Next slide, please. And here is the important one. Also, the CRVS ID business process map for birth and death registration. The consultation were conducted with the stakeholder in 3 districts. You can look here in the 3 provinces. The first one in Bener Meriah. Bener Meriah is the one province in Asia province, Indonesia. The second one in the Padang Pariaman is the one province in the West Sumatra. And also the right hand side in the eastern part in Manokwari Selatan. Manokwari Selatan is the province of West Papua province. So we are selected based on ongoing CRVS initiative and their unique geographical and cultural characteristic. That's why we need we selected 3 provinces. Further consultation with national level stakeholder we conducted to gain deeper understanding and the context, then also policies and program organized organized at the national level. Next slide, please. We know that the study has limitation, so even the selection 3 district may not fully representative of the broader Indonesia context due to the country's vast regional diversity. While the finding provide valuable insight into specific condition and practices this district, they should of course not be generalized to represent birth, death, and cause death registration across Indonesia. However, despite all in limitation, I think with the diverse recording business process and innovation that we have later informed to you, observed in this district contribute essential knowledge on overcome challenge rising from unique regional condition. Next slide, please. If you look here in the this slide, next, you know that the Indonesia MOHA, Ministry of Home Affairs, hold the primary CP registration authority in Indonesia. However, Indonesian CRVS system involve multiple line ministries like the Ministries of Health, Ministries of Social Affairs, Ministries of Home Affairs, Ministry of Education, and also the police office, and also the Supreme Court. So if you look at this diagram, of course, the whole the ministries and office is under the law, the 23 to 23 year 2006, mentioned, particularly in Article 3, Indonesian citizens and foreigners within Indonesia can report birth at their local population and civil registration office. Additionally, Indonesian residents also can report birth through registration office at the village level. So not only in the national level, but also in the village level, they can report it to the registration officer. And also we have the regulation in the under the Ministry of Home Affairs Regulation 2017 is draw sub-district implementing unit. It is also the people may register in the sub-district unit as well, if the local government has appointed an officer or established such unit. So it's very flexible to make it the registration information and registration to the from the resident. And also in our law, the name of law is law number 23 2013, mentioned that birth reporting in Indonesia should be done 60 days, 2 months of the event, primarily by the head of family. This require completed, we have the reporting form, the name is 5101 form, that must signed by the head of household and indicated of the resident family card. That's something like this, the process in the our country. Next slide, please. Then the birth registration business process across 3 study site illustrate a relative uniform, so and well-established system compared to the death or cause of death registration. Various approach for registering birth are evident in the key actor and the administrative level at which the birth registration process begin. And after we also go to the field, so the study in the 3 districts identified a different entry point for the birth registration process. For example, in the Bandar Maria, in the Manokwari Selatan, and Padang Pariaman, family can register a childbirth directly to the local population and civil registration office. Next slide, please. If you look at the table here, as I said before, so the 3 of the area they can an entry point for the registration directly, can register childbirth directly at the local population and civil registration office, with population and civil registration serving as the main actor in the sub-management process. So similar to the birth registration, also in terms of the death registration, death event to the local and civil registration in Indonesia, we have also the law for that, Article 3, Law 23. So the family of the deceased must fill the death reporting form. We have also the form to the fill this report. Then required document for death registration include like the death notification letters from the health sector or village, and then the death national ID card, and also deceased family card, something like this. And so the study discover, I think it is also important. Next slide, please. In terms of the cause of death, this study discovered that death registration business process in the 3 sites, as I said before, particularly in some process within Dukcapil, are quite similar. I said that the cause of death registration and birth registration is almost similar, as I said before in the previous slide, including the business process. However, the level of coverage for death registration is significantly lower than the birth registration. Even the step from the birth registration is similar with the death registration, but the death registration coverage is significantly lower than the birth registration. In this 3 sites, family of deceased resident can register death directly to the local population. For example, as I said before, some of the district, for example, for Padang Pariaman and also Bandar Maria and also in Manokwari, they have the application. For example, in the Padang Pariaman, sorry, please slide before, previous slide, sorry. for the more clear explanation. For example, in Padang Pariaman, in the second, you look here in the table, we have the application. The name is CPayCam application. So the health worker assists with application through CPayCam application. So CPayCam application also may make it easier for the resident to fill the registration form. And also, if you look here, also in the term of the village level officer, we have also the Dukcapil Ceria mobile application. So some area like Bener Maria and Padang Pariaman, they have the simple application, simple how we can say information system to people, and then people it easy to fulfill. Next slide, please. However, even I said before, we need to tackle the gap and challenge in birth and death registration. You know that the data quality and completeness, competing and parallel database, I think is also our challenge. Even you know that some part, for example, CPayCam in the Padang Maria district, they have the database. Even that the database is remain incomplete due to the existing of another database, something like this. And then since the implementation of centralized SAAK policy, we have the very big the data. The name is System Informasi Administrasi Kependudukan Population Administration Information System, and then it belong to the Ministry of Affairs. So the district population and CP registration office have the look like the lost their authority. I mean that because of now is the central, the system information is the centralized. So the district, so they have to, how we can say, so to fulfill and then to analyze their data based on the centralized data, something like this. This is also our challenge. And then the other challenge is there is no policy regarding the organization of cause of death in general. In the three district also there is no policy, how we can say, policy regarding organization in terms of death, cause of death. And also the other one, if you look here, marginalized individual face barrier in importing event. For example, in terms of elderly, in the elderly, the people with disability, I think this is also our challenge. And next slide, please. There are 3 slides more, sorry. Lack of comprehensive national policy that provides system and guideline for recording causes of death is also our challenge. Why? Because you know that there are some after we review the legal review, because of the variety of our province in Indonesia. So the policy that make it the comprehensive, it is the other challenge. And the current effort primarily involve system and development and pilot intervention. It is also our challenge. Why? Because you know that for example in the Padang Pariaman district has been selected as intervention district for the development of verbal autopsy mechanism by the Ministry of Health. So the strengthening certification of cause of death, we require the development and implementation of the national policy that accommodate system and guideline on recording cause of death that can be applied through national or nationwide. And next slide, please. And also we have the challenge in production vital statistic ahead of us. We currently the big effort to produce our vital statistic. However, you know that the production of vital statistic using the CP registration data, we have still remain unachieved even in the 3 study that we have conducted the study. And also the varying level start understanding among relevant stakeholders, it is also our challenge to produce the vital statistic. And authority to collect, process, and publish data is, I think, is important event is the currently dispersed across the various government sector based on their respective duties and authorities. And then last one, and the last slide is amid the challenge, even we have the challenge, we are spot the opportunities to overcome them. The first one, we have the lesson learned from the legal review and business process mapping exercise that we are conducted in the three area, and we can use them to inform strategic way forward. And then we need this harmonize the process of registering birth, death, and cause of death carry out the various sector, because also we have the many region province, and then also streamline the regulatory framework is also our moving forward to do that. And the last one is the addressing this gap and challenge in the CRVS practice in Indonesia demand and multifaceted approach that encompass policy development. So like the cross-sectoral collaboration and capacity building, we can do it by focusing this area. So the government of Indonesia can work toward achieving universal coverage of birth and death, and then standardizing the cost of death registration, and also how we can enable and integrate the data of the production of vital statistics that we hope accurately reflect the country population dynamic and also social health status to inform decision making and also inform to the policy development. I think that's all my presentation. Sorry, I think so many times we have produced, but hopefully all of you understood that my presentation. Thank you very much. Please.
Thank you. Thank you very much, Dr. Cholifahani. Only 1 minute, well, just 2 minutes over, so not bad at all. Thank you very much. That was an excellent presentation, and I think it really highlights the importance of assessing the current state of the CRVS system to guide future CRVS improvements through legal review work and also business process mapping. And I was also especially interested in the application of the business process mapping for the production of vital statistics, which I think is an application of the BPI work, which many countries are now moving towards to assess the integration of different data sources for the regular production of vital statistics. Since we are running a little bit behind schedule, we will move on to the next speaker. But please do join Dr. Cholifahani in the Ask the Author session at the end, and you can pose your questions to him then. Thank you very much.
Yeah, you're welcome.
We'll see you later. Okay, so our next presenter will be Dr. Mohammed Asif. Dr. Asif is the Chief of Health at the Ministry of Planning, Development and Special Initiatives in the Government of Pakistan. His presentation is titled Study to Understand the Existing Mechanisms and Reasons for Weaknesses, Challenges and Bottlenecks in the Vital Events Registration System in Pakistan, and how these can be effectively addressed. Over to you, Dr. Asif.
And good morning to all the colleagues and participants of this forum. This research study that I'm going to present basically aims to understand the existing mechanisms and reasons for weaknesses, challenges, and bottlenecks in the vital events registration system in Pakistan. And this study will identify the barriers to vital events registration for the people in Pakistan and how they can be effectively addressed. Next, please. So regarding the raison d'etre for conducting this study and what motivated us to undertake this study, that is basically based upon the facts. I just give you the background information. In the context of Pakistan, registration of vital events is the function of the local government departments. And according to the latest Pakistan Demographic and Household Survey, The under 5 years registration is only 42%, and while this rate is less than 5% for death registrations. While for divorces and marriages registration, no authentic information is available because the rates of such registrations are minimal, and these are quite negligible. Next, please. So in order to address and to know the reasons, as I mentioned earlier, an operational research was employed with desk review and key informant interviews. These were the two components of this research study. The desk review was done to explore the various organizations like the Ministry of Interior, Ministry of National Health Services Regulations and Coordination, Ministry of Law and Justice, provincial local government departments, union councils, provincial health departments, provincial law departments, National Database and Registration Authority. These are the few organizations, and this study reviewed and explored these organizations and their rules of business that are linked with the vital events notifications and registrations, and to look into the various processes and flows that are currently deployed, and where are such the lacunas and gaps that are leading to this suboptimal affairs of state regarding the notification and registration of the vital events. And the key informant interviews that were conducted with the various functionaries of the mandated organizations I have mentioned, and the various field staff and the general public. So in this way, this was the methodology and this study was performed. Next, please. So regarding what was revealed as a result of this study, that is the government civil registration system in the context of Pakistan that requires a newborn to be registered within 30 days after birth, and death is to be registered within 60 days after the event. There is low demand and awareness among the public to notify these events and eventually to get these registered. And as a result, the birth registration is considerably higher. What we get from the study, it is quite higher. It's 60% in urban areas as compared to the rural areas, which is 34%. And huge disparities exist in terms of birth registrations coverage among the different geographic jurisdictions of Pakistan. Like it is 82% in Islamabad capital territory, it's 19% in Khyber Pakhtunkhwa province, while it's only 2% in case of federally administered tribal areas. Next, please. And similarly, for the registration of marriages and regarding divorces, there's no authentic or information which is available. And most important, the mechanism for verification of particulars of the reporters, like the parents in case of births, guardians, and for family members of the deceased in case of deaths and other vital events, and the authentication and verification of the issued certificates is difficult because of the manual registers that currently we have in our system, and the regular reporting in this system, that is the issue which is not currently being, and regular reporting system it's almost non-existent to support flow of information at the various levels, like at the provincial level or at the district, at the national levels. Next, please. Civil registration of vital events is fragmented. It is compartmentalized and among the different sectors. For example, the health, population statistics, and social security, and such other, they are typically not able to access the same database and to generate the vital statistics from the civil registration and data. And the linkage is missing across different sectors and systems. Like, for example, in case of verbal autopsy, the system which is collecting the cause of death information, that should be able to speak to the civil registration system dealing with the death registrations. And practically, just like an example, this linkage is missing. And such there is intersectoral linkages and coordination that should have been in place. And we have identified through this study that it is currently the aspect that is to be addressed. Next, please. So what we get is the conclusions and what emerged from the study, that health sector is not mainstreamed within the vital events notification of births or deaths. And in our system, it is the responsibility of the parents in case of births, and it's the responsibility of the family members of the deceased in case of deaths to report to the registering entities. And practically this doesn't happen due to multitude of reasons, and due to and as a result, that we are facing a scandal of invisibility. The events are happening, but they are not being notified and registered. So the parents or family members of the deceased, they do not collect event information, a notification from the health facility or the community in case of some event is happening in the community, nor do they report to the registering entity for getting the event registered. And there is need to strengthen the institution of union councils under the local government departments, which is the mandated entity, not only for the births and deaths registrations, but also for the registration of marriages and divorces. Next, please. So we envisage the policy shift, and whereby we mandated the health sector and mainstream the health sector in the notification of vital events of births and deaths. And this study enabled to to work out and deploy the reforms in the system, in the various processes and flows. That is the reason it has been envisaged to establish births and deaths notification counters in the fixed health facilities. And for the events occurring in community, the same information would be communicated through the Android-based gadgets to the registering entity without anything to do with the parents or the family members of the deceased. So in this way, the health sector remains same and is made responsible to communicate the notification of these events from the fixed health facilities or the community in real time, online mode. And if for some reason, due to various reasons, like if there is some issue of internet connectivity or something else, then uh, the same system is required to be implemented, maybe in a paper mode, manually. So use of digital technologies to institute real-time notification of vital events from health sector to the registering entities has been envisaged to be implemented. And for that purpose, the Islamabad Capital Territory has been identified as the model area for implementation. And similarly, capacity of health sector in recording death and cause of death is vital to optimally utilize the phenomena of university of death registrations. So in this death registration to generate evidence for informed policy and planning. Next, please. So next, please. Yes. So during the interim period, as I mentioned earlier, the same policy shift would continue to be enforced manually, whereby the health sector would communicate such notifications in paper mode to the registering entities until the IT related and other issues are resolved in some areas where these are required. So uh, apart from the health sector, there is potential role of other sectors like education, religious affairs, and many others. As the notifiers of the vital events, they would have to be accelerated and enhanced in order to ensure a universality of vital events notifications and registrations in the system, in the reform system of the processes and flows for the notification of such events to the registering entity as a matter of system passively. being the health sector as the mandated entity and other sectors to play their role during the interim period. And not only during the interim period, after the health sector is fully mainstream, still they would be having such role to play. So next please. Keeping in view the devolved nature of the subject in Pakistan, because there is a massive shift in policy and we have a huge private sector, and in public sector we can enforce this policy shift through an executive order, but for the private sector to enforce such reforms and policy shifts and to bring about such reforms in action, we need to have the legislation. And for that purpose, this study suggested the legislation, a bridging legislation at national level that would be required to enable the provincial governments modify and conform their legislative milieu in accordance with the policy shifts in notifications of vital events and reform processes and flows, and optimally mainstream the private sector in notification of vital events of births and deaths. I mean, this is something a must, because otherwise, without such enabling, suggestive, and bridging legislation, it would be difficult to expand and to roll out the jurisdiction of the implementation of such policy reforms to the private sector, which plays a key role in provision of service delivery in various areas in the context of Pakistan. So with this, I conclude. I know there is paucity of time and we may be running behind time. So with this, I conclude. If there is any question or clarity required, I am available for this purpose. Thank you. Thank you very much.
Thank you very much, Dr. Asif, for that very insightful presentation, which highlights the importance of consideration for data sharing and interoperability, especially for decentralized CRVS systems. We are running a few minutes behind time, so we will move on to the next speaker, but there are a few questions in the chat, so I do encourage Mr. Hussain and Neil Singh to kindly join the Ask the Author sessions at the end so that you can ask Dr. Asif your questions. Thank you very much again, Dr. Asif, and we'll see you in the Ask the Author session later on. So
yes, thank you.
Thank you very much. So last but not least is the next speaker, Mr. Godfrey Mboka, who is a CRVS coordinator from the Rwanda Biomedical Center at the Ministry of Health, Rwanda. Mr. Mboka's presentation will be on a sustainable CRVS e-learning course to upskill competencies of practitioners in the registration of vital events, and he'll be sharing the experiences from Rwanda. The paper was co-authored with Stephen Bugingo, Martin Bracci, Mona Ewens, and James Bwanza. We're really looking forward to hearing about some of the experiences from outside of the Asia-Pacific region and some of the lessons learned from this e-learning initiative. Over to you, Mr. Mboka.
Thank you very much. Good morning from here in Kigali, Rwanda, and good afternoon, the rest. I'm going to share with you the Rwanda experience in terms of sustainable CRVS e-learning course to upskill competences for practitioners in the registration of vital events. Next. Next, please. I do acknowledge colleagues for their support. Mr. Bujingo Stephen from the Civil Registration Authority, Martin Bridge from Vital Strategies, James Mwanza from Vital Strategies, and Mona Ewens, consultant who supported the Rwanda in the development of the CRVS e-learning course. Next. Yeah, civil registration system provides universal access to registration services of vital events according to the United Nations guidelines. Globally, 166 million children under 5 in low and middle income countries lack birth registration. In Rwanda, before 2018, birth registration was 56% and death registration was 10%, which shows how low it was to inform the policy. Also, before 2020, civil registration service points were 446 only across the country. Next. Also, Rwanda undergone through CRVS legal review process to decentralize and digitalize CRVS system. This has led an increase of registration sites from 446 to 3,200 registration sites in health sector and lower administration level. This has created high demand for retraining needs for all CRVS practitioners. Due to limited resources for retraining of the CRVS practitioners on new registration SOPs, regulations, and digitalization of the CRVS system has also led a high demand of the training of the new cadres. Next. The COVID-19 pandemic informed the government that e-learning approach can work in absence of in-person training. As a result, the government of Rwanda decided to adopt the cost-effective CRVS e-learning approach to retrain the CRVS practitioners, which came after the centralization of the CRVS services in the health sector and at lowest level of administration. This paper presents the process for developing the CRVS e-learning course, lessons learned, challenges, and best practices. Next. In developing the CRVS e-learning course, we have undergone through different steps to ensure that we have a proper and available CRVS e-learning course. As initial step, you need to develop a national CRVS training material in the country, considering the country context. In Rwanda, we developed 4 major modules covering 4 different thematic areas. One was the background importance of the CRVS system, CRVS regulatory framework, SOPs for registration of vital events, and registration of vital events in the digital CRVS system. That was the initial step to be available before you start thinking about developing the CRVS e-learning course. The next step was the hiring an e-learning expert and a professional graphic design company to pursue pedagogical review of the CRVS training materials, co-design and engaging activities, graphic design, narration and voiceover, conversion of the module into SCORM format, and upload the course on running a management information system, RMS platform. Next. It is critically important to translate the CRVS e-learning course into the local languages, depending on different official languages that are available in the country. For us, as a Rwanda, we have only one common language, which is Kinyarwanda. So we had to translate our CRVS training materials into Kinyarwanda language. Also, we have undertaken into review of translation with CRVS technical team and provide feedback to the translator. It is critically important the technical team to review the translated materials to capture to ensure that the technical languages are properly translated. We also did a narration voiceover of the translated materials into both languages. We reviewed The review cycle of the draft e-learning course with local CRVS technical team and expert was undertaken in different stages. We also piloted the self-paced CRVS e-learning course with practitioners from the health sector and the sector administration and the cell level to ensure that the translated materials or the e-learning course which is available does not have some bottlenecks when they are undertaking the course before it is enrolled across the country. Next. The e-learning course has also undergone through validation and launch by a responsible ministry. The Ministry of ICT has launched the CRVS e-learning course during CRVS African Day that we celebrate every 10th August of each year. Also, the Ministry of Local Government, which is in charge of the civil registration, issued a ministerial circular to all relevant cadres to pursue CRVS e-learning course as mandatory required continuous professional development credits to all practitioners and cadres. CRVS technical team usually provides regular technical support to the practitioners to improve their uptake of the CRVS e-learning course. They also do monitor the uptake of the CRVS e-learning course and share quarterly results to the CRVS steering committee, which is a high-level coordination structure within the CRVS stakeholders. Next. The results show that initially collected the CRVS training materials, which included in the e-learning course. We also developed the CRVS e-learning course by engaging relevant stakeholders to ensure buy-in during the rollout and deployment of the e-learning course. The course was also uploaded in the RMS platform of the Ministry of Local Government for user access. We also issued the ministerial circular as a requirement for practitioners to take the course as a part of the CPD credits. Currently, over 900 CRVS practitioners out of 3,220 practitioners are enrolled, and over 320 completed the CRVS e-learning course. Next. These are the enablers for the CRVS e-learning course in Rwanda. It is critically important and imperative to consider the availability of infrastructures and high-level penetration of ICT services when you are going to develop the CRVS course. It is critical to consider some of these key points, including CRVS governance and coordination structures from the central to sub-national level. When you don't engage initially different stakeholders within the government, that risk not the cost to be accepted when they are rolled out. Therefore, it is critically important to have CRVS governance coordination to help from the start of the point until the dissemination of the course. The political will and leadership support to strengthen CRVS system was critically important during the development and the rollout of the course. As it has been highlighted above, the Ministry of ICT has also launched the course, and also Ministry of Local Government issued a ministerial circular to ensure that the course is taken by all relevant cadres. The technical and financial support from the partners, for instance, the Vital Strategies, Bloomberg Data for Health, World Bank, GFF, UN bodies, has contributed significantly in improving the CRVS system in Rwanda, particularly in the development of CRVS e-learning course. We really acknowledge the role of the Vital Strategies, Bloomberg Data for Health, their technical support and financial support during the development of this e-learning course. Next. Discussion conclusion, CRVS e-learning course can be readjusted and meet the country context. It is also cost-effective and sustainable approach for retraining of the CRVS practitioners. For instance, in the country which are bigger and has a bigger population, it is critically important the CRVS to be key undertaking to support the country in terms of training the new civil registrars, which are caused by the decentralization of the civil registration services. I know many countries currently are struggling or have started to decentralize civil registration services. So they have to consider the CRVS e-learning course as one of the key undertaking for the capacity building of the new practitioners. It also requires strong political support and buy-in and functional government and coordination structures in place to provide oversight. Also, it is critically important to engage all relevant partners for technical and financial support. I think this is my last slide. If there is any question or clarification, I'm available to answer that. Thank you.
Thank you very much, Godfrey, for that great presentation. I think, yeah, I definitely agree that COVID-19 highlighted and also propelled the opportunities for online learning, which can be a very useful and cost-effective tool for strengthening technical capacity. We have time for a few questions. I see that there's already one in the chat from Dr. Mercelin. Who are the target audience of this e-learning course? Is it public or private sector or both?
If I can answer, thank you very much. The target audience here are both public and private civil registrars. So all of them are the target audience from both public and private within the country, from different sectors, from health and local government structures. They are the target audience of this e-learning course.
Thank you. My colleague Tanya is asking that it would be really interesting to see a more detailed overview of the course topics. Is anything currently available online that can be viewed publicly?
Yeah, sure. The course is public and it is possible to register. So it is a matter of registering and see the course, how it is being done. It is public.
Okay, great. Thank you. If you wouldn't mind perhaps posting the link into the chat box after your question and answer session, that would be great. So I'm sure lots of participants will also be interested to see.
Sure. Actually, that has already been mentioned in the paper, and the link is already there in the paper, but I will also share. Sure.
Thank you very much. Thank you. We don't have any more questions, but I wanted to ask one. Oh, we have another one from Carla. What methods do you propose to evaluate the learning outcomes of course participants? This was actually the question I was going to ask as well.
There are various methods that we are proposing. First of all, the outcome will be measured to the quality of the registration of the registered data for both all vital events. If the quality of registration, quality and timely registration of the vital events are high, that will be one of the key indicators that indicates the CRVS practitioners understands properly the registration process and SOPs. Secondly, we also expect the completeness as the key outcome. If we find that at the end of the day, registration completeness is increasing for all vital events, specifically for birth and death registration, we will show that our e-learning course is effectively working because we have been having an issue of turnover. If there is high turnover and the new civil registrar, once they are not trained, that shows that registration completeness go down. Therefore, This course will also help for timely upskilling the skills, upskill the new civil registrars and existing civil registrars. Therefore, we expect to increase birth and death registration. At the moment, we have started to see some results. Our birth registration has also increased up to 93 by 2023. So we see they have played some significant role in terms of registration completeness.
Thank you very much.
I don't know whether I have addressed your question, Kara. Sorry.
I also noticed that in the paper you talk about the pass rate for the CRVS practitioners, that they have to pass, I think, was it 80%?
Sure.
So, yeah.
If it was the evaluation, an evaluation of the uptake of the course, I'm very sure actually the course after taking every module, a practitioner has to pass every module by 80% to take the next module. And each different stages of the civil registrars, they have their specific module because depending on their registration level. If it is health facility, they have their own specific module of registration. So they have to pass by 80% to complete the CRVS course. I'm sorry. Okay, yeah.
Okay, thank you. Thank you very much, Godfrey. And I encourage participants, if you have any further questions for Godfrey, please do join the Ask the Author session, which follows in just a few minutes. Thank you very much, Godfrey.
Thank you too.
So that brings us to the end of the fourth session of the forum, and we would like to thank all of the authors for their fantastic presentations, which provided a great insight into some of the strategies and tools being applied to strengthen CRVS systems, both in the region and also beyond. We will now be moving on to the Ask the Author sessions, and these sessions will be hosted in individual meeting rooms. There will be one meeting room for each author who presented during this session, and it provides an opportunity to ask any questions to the authors, also to provide your own experience and build some connections. You can find the Teams links for each individual room in the chat box now. And if you click on the room, so the text that's in purple, it will take you straight to the Teams room for the author that you want to join. Unfortunately, due to competing commitments, Ms. Lydia Tekla-Mariam isn't able to stay on for the Ask the Author session, but if you had any questions for Lydia, you may join the room with Ms. Vandana Shah, who will be happy to answer any questions you may have. So the rooms will be open from now until 11:45 Bangkok time. And we also encourage you to move between rooms during this time by clicking on the relevant links in the chat box. And if you have any issues navigating to the room which you want to go to, please just let us know in the chat box and we'll try to assist you. The fifth session of the research forum on strengthening processes for death registration and medical certification will begin at 12:30 p.m. Bangkok time, and you can join via the main forum link, which is the same link that you used to join this current session. The link will also be posted in the chat box. And we look forward to welcoming you back at 12:30 for another great lineup of speakers. So wishing you all fruitful discussions in the Ask the Author sessions. Thank you very much.